7:32. Let's call the meeting to order for the Fairfield Department of Health Board of Health meeting. Hopefully, everyone had a chance to take a look at the minutes from last month's meeting. Any comments, questions, edits? If not, if I can get a motion to approve the minutes as presented. Thank you. Christine, can I get a second, please? Thank you. All right, all those in favor? Aye. Great.
Aye.
Francis, are you there?
Aye. Yep. Aye. Sorry, I was still eating dinner, so that's why
That's
I don't
okay.
have my thing on.
Understand. Great.
And
Fantastic.
Henry,
All
Carolyn
right.
is on the phone as well.
Oh, hello, Carolyn.
Hi.
Hi. And I'm assuming the other caller is just is the recording.
Yes.
Okay. Fantastic. Wonderful. Why don't we dive right into the reports, Director of Health?
Sure. So I'm going to share my screen real quick, and we'll do a quick overview here. Okay. So here's let's start at the state level here. So I'll show you just a little bit of what's going on at the state level. This is current data from today. So what the state is experiencing is essentially that in a lot of cases, other than hospitalizations, is experiencing sort of somewhat increases and or at best sort of a leveling out. So and I'll share from last Friday's meeting that the directors of health have with the state. You know, one of the things that Dr. Carter said, or a couple of things that he said, which were concerning, if you will. So, and he looked especially weary. I don't know if Henry, if you were on that as well, but one of the statements he said, you know, basically is, I'm very concerned about the next couple months. And another one was, you know, we don't know what the impact of the variant will be. And so that's sort of the sense of the state saying, you know, the good news is we're holding hospitalizations level. Other than that, things are concerning. So here you can see just number of probable cases is we had this peak in December. And then as you see going forward, you guys can see my screen, right?
Yes.
And then you see that things are gradually increasing in cases by date. Here you can see the hospitalization data is you know, essentially has decreased a little bit, but is somewhat, you know, kind of holding level from, you know, we're kind of about where we were, you know, around Thanksgiving right now. So we're not back down below Thanksgiving. We kind of had a little peak, but it's kind of holding level, and the state felt like we are flattening the curve there. That's, you know, sort of the definition of a flat curve right there. If you look at deaths, and again, this later data is stuff that new data is coming in. So you'll see we're kind of on this increasing trend for deaths, you know, with some leveling, you know, right around here, a little bit of increase, not consistent. Number of tests being conducted, again, that's just number of tests continues to increase. And so we'll look at just the town data now, and we'll show you some of this. You know, we're up to 3329 in cases. That's an increase of 85 over the weekend. The Monday numbers are always increased because it represents Friday, Saturday, and Sunday. But, you know, for example, this, you know, we see these new cases. They're just not we see them over the weekend. Our contact tracers are calling them and reaching out to them. But, you know, the numbers aren't reflected in the state reporting until Monday. So, for example, over the weekend, I mean, I think when I spoke to the contact tracers, it was something like 40 cases on Saturday that they had to, you know, call every one of them and all their contacts. And so it's that work still continues extensively. We're still doing a lot of contact tracing, both in the community and in the school. And Jill can go more into that. And just to show just some of what's going on here, these are, you know, cases by date reported is showing somewhat of a leveling, if you will, of cases by date reported. And you'll see here just overall cases, the rate at which they're increasing. So this is over the summer. We had this long flat stretch, and then it's just been continuously increasing in terms of number of cases. And here's our by specimen collection date there, and you'll see, somewhat of, since, right around Thanksgiving, somewhat of a leveling of the data. This last trend here will sort of fill in as dates go on. So, we're kind of seeing this leveling of data. And even if you look back until, early December, right, in this area here, we're somewhat seeing an increase in data lately, similar to what the state is seeing. And I'll kind of scroll down here. Median age has bopped up and leveled off at around, 43. And then our, this is our cases by where people reside, whether it's in the general population, university, or elder facilities. And so we're still at 13% of the cases in elder facilities, about 20% in the university. And then what I'm going to do is just to highlight this data. It's accessible through the main data page, is the fall only data page, which kind of blows it up a little bit, lets you see it a little bit clearer, cases by date. I'm just going to, get down to where we were. And you can see here, we've been kind of somewhat level, and even since, here about, mid-December, this gradual increasing trend. And that's that. And I wanted to show you this one where, again, you can kind of ignore this last one because more data will fill in over the next week. But it shows, again, just this decreasing trend in the general population. And again, it's starting to bounce up again. And that's reflected in these dark ones are the elder facility population cases that we're seeing. And the grays that you see is university. And since it's, November, they went home, we really haven't seen any, but we're starting to see, we saw here in the November spike, some cases in the facilities, we're starting to see that again. And this is the fall deaths that have happened again. We saw this spike in, sort of mid, so we had the late November spike in cases. We had this mid-December spike in deaths, was where we're seeing on average more deaths per day. And lately it's been relatively level, but, looking at this, we expect potentially in a couple weeks to start seeing potentially some more increases in deaths occurring. And again, just the hospitalizations, with this moving average, you can see the state kind of, it's reflecting what we saw in the state. This is Connecticut, this is Fairfield County. And since, mid-December, it's been relatively level, not decreasing, not increasing significantly. And here you'll see this is reflected, the above the line are admissions, and below the line are people being released from the hospital. And so it's kind of balancing each other out there. And then I'll show you one more page here, just to reflect the data of the school data here. And as with other state and county data, we've had this decrease. We had a peak and then a decrease, and then all three town, county, state seeing an increase last week, going back up in, this is the cases per 100,000 population average. Same thing with percent test positivity, a decrease, all three showing an increase in the last week. So this is somewhat reflective of the holiday break. Hospitalizations, state and county, showing relatively level, little decrease there. And this is ILI, influenza-like illness at the hospitals. And then I just want to get down and show you this one down here, sort of, the difference between what we're seeing now still in school-age children. So each dot represents a case, and there's many overlays here. And this on the y-axis is the age of the cases. And so you'll see, a few clusters back in April, a few cases, a little bit over the summer with some of the summer outbreaks, start of the school year, and then just continuously ramping up with lots of cases. Definitely much less at the 5 to 10-year-old range than up at the middle school and high school levels. And so that's sort of a summary of the data, where we are, what the state is saying. Of concern is sort of, the state epidemiologist, Dr. Carter's statement about, um, very, very concerned about what's going to happen over the next couple months. So we're starting, the big concern is really about the B117, I think is the appropriate name, or the UK variant of the, let me stop sharing my screen now. So the UK variant is what's really causing the concern in Great Britain. It was the similar type of thing. We saw the peak, then it came down, and then it started coming right back up, and it's above where the peak was previously. And so the fear is that is what may happen here. The good news is, at least right now, hospitalization and hospital capacity is available. And so while concerning that we're going to see a large number of cases, since the variants are more transmissible than the previous variants of it, that there's concern that we'll see some increase in cases, and we're starting to potentially see signs of that. We don't know if this is a post-holiday bump or the start of potentially another increase in cases. So that we'll have to wait and see. As I said, the contact tracing continues. I'll let Jill share about that a little bit more. And so just to end, really since the last meeting we had, really nearly, other than contact tracing and the normal information we put out, really the sole focus of the health department has been vaccination. So we've conducted 5 clinics so far. We've done 1,844 vaccinations. We have another 2 clinics this week that we have, put it this way, we have 1,008 spots available. We have 941 doses of vaccine available. So we have more spots than we have vaccines. So we might have to, if we start maxing out, we may have to go hunt around for some doses and see if we can get it, or cancel some appointments. So the big change this week, just today, the state of Connecticut, and we kind of got hints over the weekend that this was happening. So we were able to get prepared for it. That the state today announced that for those entities experiencing slack in their clinics, so vacancies, not all your appointments being filled, could start moving into phase 1B, those who are 75 years and older. And so we were ready to go today because last week our clinic, we had 924 slots available. We only did 606 vaccinations. We then, promptly transferred the balance of our vaccine to Southwest Community Health Center, Bridgeport Health Department, Milford Health Department, and Monroe Health Department. So we transferred 370 doses. That was sort of the balance, and a little bit more, because as we planned for this week, we were thinking, well, we might be under again, so we can give away a little bit more. So now this changed that we can move to phase B. And so we were ready, thanks to my wonderful staff, to post thanks to Andrea specifically, post a survey through our website and the information. And then what that enabled is everybody. So the big bottleneck for a lot of people in phase 1A has been getting through the VAM system, the Vaccine Administration Management System, so that they can sign up for spots. That was, what some of the primary struggle that we hear from medical professionals is just getting into that system. But we did vaccinate a lot of people from that were in that category, and saw some slack last week. We posted our clinics earlier this week, and over the weekend we were only at 150 out of the 1,008 spots booked. So we knew we had something, we had to do something, and so we started the inquiry of the state, and the state kind of said, just hold on, there'll be an announcement either Sunday or Monday. But they kind of hinted at, if anything, it'll be 75s and older, which they hinted at last week, saying that if you have an unused portion of a vial and you can't give it to a phase 1A, you can give it to a phase 1B in these categories. And so we were sort of authorized last week to give out only in those cases. Now this week they're saying 75. So we were able to post a survey at 2:00 today. By 6:00, we had 1,200 responses to our survey. We are able to take that data and upload those 1,200 individuals into the VAM system. And in less than an hour from uploading that, and this is probably old information, excuse me, we had 100 new appointments in our in VAMs that we could see, and so we think that'll continue overnight. We'll probably see. I could pull it up now, but we're pretty sure it'll continue to go up. And so we'll see what we get by tomorrow morning, and we'll first thing tomorrow morning upload those. And so really essentially what we're trying to do is fill up our clinics this week. And so and then the last thing I'll say, I just crunched some numbers just prior to the meeting tonight and again, this will probably change after this week's clinic, but of the 1,844 case vaccinations that we've performed, 69% of those have been people from other towns that reside in other towns. And so 31% of those have been people who reside in Fairfield. So we are, we are not just vaccinating Fairfield only. The clinics are open to all, and the data shows that we are vaccinating, more than twice the number of people that live out of town than live in town. And so that doesn't necessarily reflect where a medical professional's practice is. They're being signed up by their practice. So a lot of these people may be in practices in Fairfield. But, again, a lot of it is police, fire, EMS from lots of other towns, so, we did, 245 people from Bridgeport, 167 from Trumbull, 90 from Stratford. I haven't run all the numbers yet, but so we've done people from a lot of other towns, and so we'll continue to do that. We'll continue to push the numbers. That's what we feel is the most appropriate focus for the health department right now is not having vaccines sitting in freezers and refrigerators, but getting it into people's arms. And so we are applying as many strategies as we can to fill those slots. Last week we were down to, we had maybe 200. What was Jill? About 250 slots filled. Just 2 days before the clinic, and we did a concerted effort of reaching out to people, and we got up to 606. So we'll try to do that again this week, fill it up, and we're trying to get more people vaccinated. So I will end my remarks there.
I have a question. Can you hear me okay? Okay. So about the vaccine clinic, I'm glad just one statement on that as somebody who is not in a facility. I think one thing that could be helpful, I know we talked a little bit, but maybe some quick little education blurb about kind of how to find it, because I'll tell you, even from my home healthcare provider, I told you this when I got the vaccine on Wednesday, is that they said they were partnering with Meriden Health Department, and I was wondering, do I really have to go all the way to Meriden? Because that was going to be complicated with my schedule. And then when I talked to you, you said, oh no, if you go through the VAMs. And then I found it deep in my email in a weird trash area. So that's another kind of logistical thing, is it was in my trash. And then I found it logged in. Once I did that, finding Fairfield was great. But I was a little bit shocked at all the empty spots. And I kind of educated at least some people I knew how to find it and then how to maximize. I had a friend who was going to take it 2 weeks from now in Norwalk, and he did come to Fairfield the next day because of the open slot. So I wonder if, just a little more messaging from that standpoint. My question though is for some of the elderly population who maybe aren't, not to stereotype, but maybe don't have as much tech access. I see that a lot, certainly in home healthcare. how are we dealing with that so that they have the opportunity? Because even me, who's semi-tech savvy, I mean, going through the VAMS questions and just kind of how you click on things and then find the schedule based on the location, it's a little tricky. It's a little tricky.
It is, and I agree. And so the state is supposedly they plan to roll out later this week other options to get people into VAMs. So similar to what we have, they're going to do a survey online and they will upload people individually into VAMs. It still requires the person to go through VAMs. So what is happening in lots of other towns, and I know Henry is doing it in Stanford and others are doing it, is people are doing what's called closed pods, which is what was happening in Meriden. And so essentially those individuals doing closed pods have essentially survey the individuals more extensively and then schedule them independently of the VAM system, and then simply upload that entire roster of individuals and all the data that comes along with it into VAMs. So there's opportunities in the area, and so that's one of the ways that we're going to collaborate. And the state said they're looking at providing an option for residents to simply call 211 and be sort of walked through the system and assisted in filling out the forms. And so
yeah, it seems like if there would be a way to partnership,
yeah,
even with Bigelow, like utilizing the social workers, even if it was like some sort of drive-through type thing for those who don't have the right access.
yeah.
I could just see that being.
I think all those approaches, even a paper system where people will fill out a paper form and it will be uploaded, are things being considered. You know, the state, everything is moving very fast right now. Like we didn't think we were going to go to phase 1B till February. And so the slack that we experienced last week and that other clinics were experiencing this week in people signing up pushed the state to I think, or inform the state that they need to adjust quickly. And so the systems, as we were, when we started the first clinic in the 23rd, we had no idea if the VAM system would work, what it would be like, and luckily it did work and was what we were able to navigate all the quirks of it. And so we will, as we go on another week or two, have many more ways for those who are 75 and older to get into the system and be vaccinated.
Sans, can I say something now? Julie sent out an email this afternoon at 3:00 on this whole thing. Everything that it includes, and proof of age required in this VAMS, and you have to fill out this form. So who's ever on the senior citizen email list has gotten that today.
That's great. Yeah, Julie and I talked this morning when I heard this news that we could do this, when it was confirmed. Julie and I spoke and she said, yeah, she's got a list of about 4,000 people. And several of us, spoke to her today. I think Andrea and Santina and myself all spoke to her and, got her the information that we posted, and she got it out to that list. And I think that's why we're seeing the numbers that we are. I mean, it's between 5 and 6, we went from 400 people completing the survey to 1,200 people completing the survey.
Wow!
And I'm sure right now the number is through the roof. And tomorrow morning we will upload whoever came in tonight, and we'll hopefully get lots of people. So it's getting at the people that have the tech savviness or have someone that can help them through it right now, and then we'll work through the rest of the folks that where that's more challenging for them.
Right. She even said to check the. I was going to say she said to check the spam and the junk folders for the email. So she's covered just about all the bases for this.
Great.
Sans, I have some of the teachers. Any news when maybe I looked on your website this. A few people asking me, and it really only covered the 1B that are 75 and older. Any idea when teachers may be included in that?
Nothing clear yet. The state is the one who
Okay.
just is the gatekeeper on that. So we're waiting to see. That's the teachers are really, I will say, in terms of the VAM system, that's some low hanging fruit that as soon as they give us the okay, we can upload it into the VAM system. They can figure it all out. They can make appointments for clinics. We have clinics scheduled from now through mid-February. So we've got some 5,400 slots scheduled. We don't have that vaccine yet, but we have lots of slots scheduled. And, if it really depends on what kind of vaccine, how much vaccine we receive, and when they make that decision, what we have on hand. But again, we will be doing vaccination clinics for the next 4 weeks. After this week, 2 days a week. We'll be doing 504 people per day, and as long as we get the vaccine, that's what we'll be doing. And so we'll be offering it as soon as it's available, and we can. The school system is ready to go. They've got their lists. All we need to do is, upload them, and even they may be able to do it this week because the state said they'll be looking to sort of onboard as employer coordinators some of the phase 1B individuals. Not saying that they'll be able to upload them yet, but that that when that so that they're ready when the state gives the okay to do the rest of or some portion of phase 1B. Phase 1B is a very large group, and so that will likely, they may roll it out like they did now in smaller groups, focused on priorities.
All right, thank you. Thanks.
Sure.
Christine, do you have a question?
Yeah, just to follow up on that. Is there someone at the state level that we could advocate to get teachers moved along, try to speed that up? Obviously, we're very anxious to get staff vaccinated.
Yeah, I mean, I think that the governor the governor consults with his experts and he makes the final call on a lot of these decisions. So I think just getting it to the governor's office, and that's where it'll push down to the agencies, and the agencies will, the experts, the epidemiologists will say, this is what we think, and then the governor makes the decision.
And I just got a couple questions from teachers that don't work in Fairfield. They can still get vaccinated in town, correct?
Our clinics, yeah, any clinic we post in VAMS is open to anybody. We don't restrict it in any way.
Okay, thank you.
Any other questions for Sands? All right, Sands, I just wanted to make a quick comment and share this with the rest of the board as well. Just to give folks a little bit of perspective who aren't as familiar with sort of the numbers. Again, I've got to give kudos to Sands and his team about their accomplishments in terms of vaccinating the public. I will tell you that per capita, if you look at other towns of comparable size, they aren't even coming close to what Sands and his team has been able to pull off. Just to give you, being this is public, I'm going to be very careful about, because I don't want to get Stanford angry at me, but I will tell you, for example, Stanford Hospital has vaccinated probably closer to 4,500 people in the same amount of time, but that's a hospital system for a city the size of Stanford. Stanford's health department has not done this kind of number. So, again, Sans, kudos to you and your team. There's some departments of health, even in Fairfield County, who haven't even gotten vaccines, let alone put together clinics to vaccinate their communities. So I think that's a great. I think Sans, you and your team again are doing a great job. Did you want to make any comments about either schools or team sports? Again, not to necessarily open up a can of worms, but if there was anything you wanted to update on the board on.
Yeah, I mean, we just got notice today that CIAC is going to be discussing it on Thursday. This DPH put out on the 8th some recommendations regarding what should and shouldn't happen. I think we'll have to, I think we'll have to wait and see what happens with CIAC and DPH, because that's really the driving force on this. I don't think, most towns have not chosen to go independently of those decisions. And I've been surprised before, but I'll be surprised if CIC does go to starting practices again with numbers. The numbers are equivalent now to when everything stopped, and are in some cases trending upward. So I would be surprised if on Thursday they came out and said, full on, but we'll see. We'll just have to see what CIAC decides.
I have a question based on that, since everything is sports focused. Hopefully Christine will appreciate this too, but the music departments and theater and singing and performance, I mean, there always tends to be kind of that focus on the sports piece, and it's like, who's the parent organization giving the kind of thumbs up and call for those kids? I mean, that's just one bracket, but I think it's analogous in a lot of ways. Just kind of throwing it out there as a question / statement. Any thoughts on that?
So, again, it's we were asked by the superintendent what our thoughts were on one particular element. Jill, I think if it was band.
It was band
practice, and
they wanted to do the before school practices in the morning.
And so we Jill and I simply directed the superintendent to the data that showed that, similar to what I said with sports, the numbers now are about as high or higher than when it was canceled. And so, I don't see necessarily that we should be bringing, and we've got other variables coming back into play here with increased density in the schools and new variants, and an increasing trend right now in cases going on. And so it's to introduce additional activities is of some concern, and that we should potentially get some experience, see some experience once school comes back in increased density.
Okay, just on that point, this is a little bit of, I guess, my 2 cents. Surprise, surprise. But I think there is a big difference between band and the sports situation. Obviously, one is inside, one is outside typically. But certainly from those Carillon and Candlelight, the videos that they were able to do, they were able to have very distinct distancing. You don't have to have contact, and the little shower caps on the trumpets. And, I'll just say, I know that the way that it's, probably because I sent that email on Friday with about my 5th grader, but it's like what they're saying with just missing those things, especially like that, the elementary school, it's a pretty small cohort where they could space out. I just would like there to be a little more of a push, like towards some of those, other activities. I think they're just, many of us are seeing that the breakdown in our kids with the lack of the outlet, just saying.
Thanks, Sally, for bringing that up. I think, again, the value in that discussion is just keeping topics like that on the forefront for discussion. Everyone will have to make sure that that awareness is a key part of this discussion. So thank you for that. I'm also going to, as part of that discussion, I just put in the chat a link to an article about that Sands and I both received from a representative, and I apologize, I cannot remember, but it's a senior organization, if I believe, if I remember correctly. And the message that he was conveying is just really, I think, education. We were talking about this. Education is going to be a big part of making sure that people understand the vaccines and potential myths and dispelling myths and whatnot. He added this link to the email. I read it. I thought it was very helpful. So I just thought I'd share it with you. If anyone wants to take a peek at it, it really does address some of the major misconceptions and myths out there. And so we're going to, as part of the Board of Health, we're going to be instrumental in educating the community. So I just wanted to share that with everyone. Jill, you ready? Your report?
Sure. Well, my focus has been, of course, the vaccine clinics and the schools. We had a bit of a break, of course, over Christmas. And I just wanted to address perhaps some of the numbers that people have been seeing in terms of that data. If you took a look at the daily dashboards that that FPS puts together, which is based on the data that the nurses collect every day, there was a headline actually also in the Connecticut Post about 300 in quarantine and in Connecticut schools. And I just want to address that because this past week, you bet, there were approximately 300 kids in quarantine, but it was very much related to travel quarantine, not exposure to any particular positive cases. And it's very time limited. And now we're going back and people are able to test out of their travel quarantines, and the number is dropping dramatically. As soon as I catch up with all of the emails that the nurses have sent me with the negative results. In terms of the positive cases, if you review them, about a week or so after Thanksgiving, we were up around 30 active cases among students. It dropped down mid-December to mid-20s, 22, I think, 22 to 25 or so. And now we're back up to about 30 cases today. And I think that might be consistent with a post-holiday increase. I mean, it's not significant, I don't think, and I hope that we see a reduction soon. Overwhelmingly, it's household exposure that it's the cause of most of these cases. But that brings us to what's going to be happening in the schools in the next couple of weeks. When we came back last week, the middle schools and high schools went on a further evolution of their cohort schedules so that cohort A 1 week meets Monday, Tuesday, Wednesday. The following week, cohort B meets Wednesday, Thursday, Friday, and they rotate that schedule through with exceptions on days that were 4 days long, like next week with the Martin Luther King holiday, and they'll just split the week. So they're bringing more kids back in. But I think for the middle school and the high school, the cohorts are even a bit more tighter. They have, thankfully, they have 3 days in a row where they have a live in-class experience. And I think that will be really beneficial to many, many students. In the elementary schools, starting on January 19th, next week, they are offering 100% in person. And Christine, please correct me if I get any of this wrong. And for the most part, the elementary schools will be in session from 9 till 1, at which time they'll be dismissed. Children will be going home, grabbing a lunch, and then they'll have additional streaming classes in the afternoon. And I believe that those are mostly the unified arts classes like gym or music, art, which they can do just via the video. Now, that, of course, and we had a discussion about this morning, the in-person density is going to increase significantly. And Mr. Cummings shared some of the numbers of who's going to be in what classroom, and they're going up a lot. They will not be able to maintain in most, if not, well, I can't say all, in most of the classes, the the 6-foot distance that they are now. Which brings us to the point, if there's a positive case in a classroom, the quarantine numbers are going to be much, much higher. We even thought that perhaps there might be some exceptions to it, although I don't think that we can see that right now, that we would end up quarantining an entire class if there was an exposure of a positive case in the classroom. Now, this is kind of the standard that's used in other districts in Lower Fairfield, Lower Connecticut, Lower Fairfield County, for schools that have been 100% in person since the beginning of the year. And to tell you the truth, even Westport uses it, and they're in a hybrid model as it is right now. So let me see. I think that it's important to keep in mind what Sans mentioned earlier about the incidence of disease in the 5 to 10-year-old age range, that it is much significant than in the higher grades. And I think that will play in our favor in terms of the actual numbers, but a little bit too soon to tell on that. Let me see, what else? Actually, I think that's really it. Just how the numbers are in a bit of a flux right now, but I think that we'll see some gradual flattening out, hopefully, once all these quarantines are over with, and then we'll go into this next phase with the 100% in person being offered in the elementary schools.
Great, thank you, Sally. Do you have a question?
Surprise, surprise! I have questions. One question, and thank you, Jill, for the overview. Okay, one question is, you mentioned we're at around 30 cases right now. Is that students and staff? Is that including everyone or just students?
Students, just students.
Okay. What is that number with, do we know, with staff members?
On the dashboard, I didn't take a look at that today. I think, well, I did, but I think it's, Sally, I don't even want to say.
No, that's okay. Yeah. No worries. Yeah. I did see that article that you cited, the 300 in quarantine in Fairfield, which was really irritating. Not going to lie. How many students do we have? 10, isn't it close to 10,000? Is it more like 9,000 something now?
No, it's over 10.
It's over 10,000. So basically that's the 300, that's 3%, right? If I'm doing my math right, that are in quarantine. And if it's 30 cases, it's 0.3%, right? So, I mean, what I would love to see, Sans, and I'll throw this out there to Brenda too, is I'd love to see a little bit of positive PR spin happening sometimes, because it just seems like that's literally 0.3% of Fairfield students have a case of coronavirus. Compare that to 300 Fairfield, students are in quarantine. That's a scarier number that, like you said, and you answered my question in your explanation, a lot of that was basically a self-created quarantine based on the travel, right? That they're now testing out of. Yeah. So I'm just curious what your thoughts are on that, because I feel like things are always, the glass is half empty versus half full.
Well, I'd like to say something too. It's not, I don't think, their job to put any kind of spin on it. It's the fact they're just presenting the data, and people can take it, or if Brenda on her weekly thing her weekly update would like to put a positive spin on it. But I think it's, Sans and Jill are doing such an amazing job, and so are the school nurses. I had some issues with my son a couple of times. They're doing such a great job. I don't think it's up to them to put any spin on it, because you'd always have the mom to come back and say, well, that's still, whatever, 0.3% of our students that are affected. It's just, they should just present the data as they are. And
I spoke to Andrea Clark about it, the director of communications for FPS, and she did contact the reporter and asked him, just told him, what the facts of the situation were. I think it was kind of hidden in the last paragraph of the article, but I certainly got a few emails about that article today, and it was
it was definitely like a clickbait headline. But no, that's a good point, Mary Frances. I hear what you're saying. So I do have a couple other questions. And this was something I'd asked the last time, but as far as the students and staff members who are asked to quarantine over the last number of months, do we have more numbers as far as how many of them actually end up becoming a positive case after, like, during that quarantine period? Because it was very low last time. It was like basically nothing.
Do you mean in school transmission?
Well, there's two separate questions. One is basically it ties together into one, like how many end up definitively being an in-school transmission after they were asked to quarantine, because based on the last meeting, it was 1 to 2 possible.
I have not had any more incidents like that are questionable.
Mm-hmm.
I know of new cases since last time we spoke that are definitive in-school transmission.
Mm-hmm.
I will say, though, that, of course, a number of those kids who are out on quarantine because of a mom or a dad or a grandfather or a sibling being positive, a number of those have converted to a positive result. But it's a result of a household exposure, not in school.
Okay, that's
one other thing I did want to mention. We did adjust the quarantine time frame based on recommendations from the CDC, and they are going to 10 days for an exposure. Well, the CDC, let me explain a little bit further. They did still say that the 14-day was the safest. 14-day quarantine was the safest approach. But that they offered a 10-day and a 7-day quarantine with testing to increase compliance. We decided when Sans and I spoke with the school administration, that we would not accept or adapt the 7-day with the test out option, that we would use the 10-day option. Since that time, I don't know how familiar you are with Addendum 5 from the school reopening guidelines that we started way over the summer. And they keep on sending out addendum every now and then. Addendum 5 was adapted over Christmas break, really, to reflect those changes. Hidden in the footnotes of that were recommendations that certain staff members who need to give services to children, among the not all special ed staff, but CLC staff, other kinds of what do they call that? Contractual staff, like speech and language pathologists, OTPT people, that if they were positive, that they should, if they were exposed to a positive case, that they would go on a 14-day quarantine to extend that. And I think the reasoning for that would be to really protect the children that they are with. Certainly at a 14-day quarantine, your post-exposure risk of transmission is less than it would be at 10-day, and it would optimize the special ed population to remain in school as best they can. The other recommendation that they had was for student athletes to be out on a 14-day quarantine due to the nature of, physical contact in most sports. So,
thank you.
Christine, I think you had a question.
Jill, do you know if everyone that quarantines goes and gets the test?
They are not required to go get a test. We collect data on everybody who does get a test, but certainly not everyone is required to. And a lot of times, Christine, people go get tests almost immediately after they find out they have to be in quarantine. And that doesn't give us very useful data, because we recommend that the best time would be 5 to 7 days after close contact exposure to have a test. We also recommend that if you have symptoms, you go out and get a test that day.
And so are you seeing a lot of, my biggest concern is just the asymptomatic cases, which I think 50% could be asymptomatic. When you're doing the contact tracing for positive cases for students, and you say it comes from a family exposure, how can you tell if that family exposure was, maybe the child brought it to the family or vice versa? Is there a way of knowing?
Well, whoever gets it first, I would imagine.
Is it?
Yeah, I mean, if the mom or dad are positive and they're in the same household, that's what we would call a household exposure.
And do you track if any of the positives for students, are they all symptomatic? Have they all been symptomatic, or you don't get to that granular level?
Oh yeah, we certainly do. We certainly do. We also ask if there is a known exposure, and I'll have to tell you, many people that I interviewed over Christmas vacation, it was unknown exposure, and we do document that in the FPS database.
Okay. And just thank you for all of your work. I just want to say it again, Jill, for all the contact tracing and your guidance through all of this, because thankfully we really have not seen very many cases of in-school transmission, which is giving us the confidence just to move forward, to bringing kids back into the buildings, even despite our numbers. So thank you for that work. My other question is just about testing for staff, these quick tests in school. Do you think it would be at all beneficial? I know some districts are doing it. If a teacher comes to school and not feeling well, does she stay or he stay, or do they go home? Do you think that it would be valuable to have that resource in the building to be able to quick test?
They go home, and we just have I know that not many, some districts are offering in-school testing. They are offering it in places that have what do they call it? The in-school, Henry, you would know, the in-school clinic.
Health centers, yeah.
Yeah, the school-based health
centers. Yeah.
Yeah, thank you. We don't have that. We just have the nurse in the nurse's office. And I don't think that there is a lack of availability of testing to require that. I don't see putting that additional layer of work onto the nurse at this point.
And just if I could add that, just so people are aware and people can promote this, is that, and I've shared this with the superintendent and all the chiefs, that there is a new testing site. It's been up on our social media, our website, a new testing site at Seaside Park through CIC Broad Institute, which has lots of capacity and is highly underutilized right now. It's very new, and it has priority testing. So it has a special lane just for people who are teachers, people who are first responders, EMS. So,
thanks.
Yeah, so our capacity for testing went up dramatically in the area just this past week. I drove through the site just to see it on Saturday at 2:30. They're open 12 to 5 on Saturday. There was nobody there, not one single car waiting to be tested.
And is that a full drive-through, or do you walk out?
Okay. Full drive-through.
My mom grew up 1 block from there. Just want to throw that out.
No, it's a beautiful park. My wife and I hike there, every other weekend or every third weekend or so with our dog. But I wanted to go walk down and see that site, and we drove around it, and I really drove around, and I pulled into it just because I didn't see any cars, and I thought, well, maybe it's closed, but I turned out I pulled into the gate, and somebody came out and said, "You here for testing?" And I said, "Oh no, I'm just curious," And so, but there's not a single person getting tested, so there's plenty of capacity there. They're open early in the morning, 7 days a week, 12 to 5 on Saturday and Sunday, and long days. I think it's like 8 to 7 during the weekday. So lots of capacity.
Sorry, where was that again? I missed that.
Seaside Park, Bridgeport. So if you go,
right.
if you do the 211 search for clinics, look for social media, it's up there. Lots.
Drive down Park Ave till you can't go any further, right?
That's it, and then take a right.
Since it's one of the DPHs, that's one of the state contracted.
That's a state contracted free site, so anybody can go there, and it's with priority testing for the priority population. So it's an ideal thing to have in town. And I'll just add, we're still working on. We just signed the agreement with Yale to bring another testing site to Fairfield. So it's still several weeks away. They have to do some construction work, but we will be at some point having a additional Yale state contracted testing site in Fairfield specifically. So,
James, what's the turnaround time for those tests?
The Broad is one of the best turnaround times. So you're usually getting results within 24 hours from Broad, and so they kind of say 24 to 36, but I've known people that have done Broad that get their results back in less time than that.
That's great.
Yeah.
That's great information to have, Sans. Thank you.
Great. Anything else, Jill?
Not for me, no.
Great. Thank you. Sans, any communications?
Other than that email that you shared that was addressed to yourself and I, though, just
Okay. Great. Any old business?
no,
No. Any new business?
I have none.
Fantastic. Anyone else have any comments, questions, concerns before we adjourn? Wonderful. Great. Can I get a motion to adjourn? Thank you. Motion carried.
Second.
Meeting adjourned at 8:28 p.m. Thank you, everyone.
Thank you.
So,
Thank you.
Thank you, Sans and Jill.
Yeah, thank you for all the work you're doing.
you.
Really great. Thank you.
Thank you.
Good night.
Can I ask you a question
Oh, sure.
off the record?
Sure.